Okay, so can you do a fat transfer at the time of a breast lift? In general, you can, but there's a few things to consider when you're making this decision. So separating surgeries out often leads to the best results from each individual surgery, but it's hard as a patient to have 2 different surgeries and 2 different downtimes. So we always try to do things together if at all possible. The first thing to consider is how aggressive is your particular lift going to be, and you can talk this out with your surgeon. There are some surgeons who just tighten the skin up a little bit. That's not an aggressive lift. Fat grafting is totally reasonable, and you could do a lot of fat grafting in that situation. I like to be a little more aggressive in my lift with more cutting through the tissue. That, of course, can cause problems with blood supply and make grafting more of a problem. Some lifts are really aggressive, where we basically create a mastectomy flap, reshape tissue, move things around. This is more common in massive weight loss patients. And when you're being really aggressive like that, you're going to have a lot more trouble with your fat grafting take. So simple lift, your surgeon may be fine with fat grafting. More complicated lift, they may recommend you wait. And the final thing to consider is if your lift is being done at the time of implant removal. So implant removal lifts are a whole nother animal and cause a lot more issues with blood supply, especially if you're removing the capsule. So it's a lot more common to recommend waiting for fat grafting if you're doing a lift at the time of an implant removal. So you often hear conflicting things because there's so many ways to do lifts, and so surgeons are going to give recommendations based off of their technique.